We're on a computer. All right, we're recording, and we didn't miss too much. So anyway, what this is fire and EMS, not just fire, not just EMS, fire and EMS collaborating to provide a strategic vision of how we move to the future in our ever-evolving future with obviously some real issues that we're going to have and obstacles that are going to be coming. So one of the things I like to start with, instead of just getting everybody for 32 people to go on here, first of all, if you put in your notes your name, and if you're fire or EMS or you're both, and one sentence or a couple of words what you hope to gain out of this. The procedure is, once we get started and I get down through all the slides, what we're going to do here is everybody gets a chance to participate 1 or 2 minutes at a time. What we'll do is you put in your comments or put your hand up in the chat that you want to have something to say, and between Jonathan and I'll try to keep some order in it. Additionally, Nick has put together some infographics, we'll call them, and at some point we're going to let Nick add him. I like him because it gives us some visual of some of the stuff we've talked about already. Anthony Majira, you could be whoever you want, fire, EMS, or educational or whatever, but we're well glad to have you with us today. So
it's only because you know me too long, Anthony.
Yeah. So I'm going to put up the start with the main infographic. So I hope that you appreciate Jonathan. I added Unity. Let me get this small again. I don't know why this did this. So we came up with at least one value, if you call it, of what we're doing, and we're united. We have unity. We have unity in service, and that's who we are. And I'm going to rehash this every time, but basically what this is looking where's fire and EMS going, either individually or collectively. And I picked fire and EMS because we have a lot of similarities. So Jonathan came off, and now I got to re-emit him. Hold on. The only problem is when I have to emit people, I have to reduce the program. Sorry. So you know, what's old and new that's going to go into the future? I got to find out how to let somebody else emit people also. What's old, new, what's same, going to be different in the future, what's good and bad and good, what's going to be obstacles and opportunities. What do we need to do in the next 6 months to a year to be ready to move forward? And the key to this is an open-minded view to the future. We need to have an open-minded view of where we're going. And each time I do that, it's because somebody else needs to be added. So that's how it started. The first, we're up to 41 people. That's crazy. So, you know, that's what we started. The first week was the brainstorming. There's continued brainstorming. Before I go any further into the strengths, weaknesses, and opportunities, one of the things I want everybody, whether you're fire and EMS or both, EMS week's coming up. So be prepared to utilize this information. We need to present ourselves in a very positive way for EMS week. We need to give ourselves an opportunity to market, and we'll talk about that a little bit, brand, and put ourselves out in front of America, both internally, externally, however else we need to, so we can really get out there and, you know, utilize this information to show who we are. So We did a SWOT. You know, if you don't know what is strengths, weakness, opportunities, and threats. The first week we did obviously strengths, and that's more of an internal thing to look at. And what we looked at. I'm sorry about this. And what we looked at was we're all hazards. And by the way, this is changeable. We can add to it, delete from it. Everybody's part of this. But all hazards are adaptable to a point. We solve problems. We have value. Although, as we're talking weaknesses, what is our value? We're always on the front lines of adversity. So people respect us for that. We collect data. But again, as we'll discuss, what do we do with the data? Our strengths continue. We have respect and awe, tribal dissension. Also, we are good at times of being close tribe. And this needs to be changed, but there's a fire economics model as well as EMS to discuss, you know, giving us value other than being a business model. We have political connections. Again, how we use them is not always the best. Identifying and recognizing weaknesses, we do that. What we do with them is a whole nother thing. And we're interested in supporting others. We do customer service. Again, how do we utilize that to our benefit? We're reactive innovation, which is good, but we're going to talk about proactive. And we have a culture that's understood, and for most part, it's valued. Our weaknesses, this is what weaknesses just generally are. I'm not going to go through this. If you need to see the slides, please let me know. And our weaknesses that we identified, what are our values? We have values, but what are they? And what do we value? And as we're going to talk about later under data, how do we take our data to show our value? We are reactive, as we said. It's a positive, but it's a negative. Fire and EMS usually reacts. We're not too good at looking to the future and how we can adapt and evolve for the future. And you'll hear the word evolve a lot from me because I believe it's key. Data analysis. Jonathan and others have talked about it. What do we do with our data? We don't utilize it to the best of our ability, and I would say fire is even worse than EMS. Again, marketing and branding, some do it well, some don't, but overall, collectively, we don't do a great job of marketing or branding ourselves and our products and why we're a benefit to any community and why they should value us. Especially more and more layoffs are coming. I keep seeing them, and I think as we get closer to the beginning of the year, it's even going to get worse. Financial streams, how we get our money, where we get our money, and that's a changing process. That's a moving target. How we get it now maybe should change. We need to discuss that under opportunities. And we lack an understanding or promotion of what our value is. We need to be more clear that we could put out in a trifold with 3 to 5 bullets of what our value is that impacts our communities, that get them to go, wow, you're important. Lack of coordinated political action, lack of unification. We have the IFC, the IFF, NAMZ, the American Paramedic Association. We have all these agencies, and we talked in detail, and this is where we need to look for opportunities of how, when we get to opportunities, how do we make this coordinated? Are we ready for the evolution of way things get done? I think fire and EMS is still just dealing with where we're at today, and I don't know, a lot of us didn't think evolution was ready. Reduction in incidents. I mean, our value has been we respond to a lot of stuff, and that's down. And one of the things I'd like you to put in your notes, whether you're fire and EMS, is your call volume up, down, or still the same. But I think we could talk about reduction in incidents as possibly an opportunity. Reduction to the type of calls we go to. Funding is a problem, possible staff reductions, unexpected obstacles. We don't know what's coming, but we need to look for them. Lack of organized customer, what I have here? customer service. It's hard to see on a culture, lack of values. We at least, with this group of loose-fitting people and a group of just people interested in discussing and trying to do something to develop a strategy, we at least come up with one value, and that's unity. And I'm thinking another value we might have is service, and I think another value we have is collaboration. And do we do enough of introspection of our organization, of where we are, or do we have an unrealistic analysis of who we are? Do we really look and see who we are as we're doing with the SWOT analysis? Poor data collection, poor data use. Fire is worse than EMS again. And I actually was on a conference call the other day. I told fire they could learn a lot from EMS on doing documentation. And as Jonathan and others said, we don't synthesize that data. So what is the data? Why does it matter? How do these outcomes in the data collect impact the services we're providing and also show our value? And I got to do an escape again. We're going down. So we're going to get today to opportunities, a general perspective of the opportunities. We want to look at trends, what's out there, emerging trends, and is there an unmet need, want that you can fulfill? Can you geographically expand your footprint? And as Nick talked about, maybe not expand, but have a better footprint, because we're collectively, and I know our county fire chiefs in Burlington is working to be one voice instead of 44 different voices. And this is a key one to talk about today. Are there potential partners or opportunities for collaboration that have not been tapped? So I want you all to think about all of them as we get to it. And real quickly, be ready to adapt when opportunity shows up. Consider other industry practices. These are some I threw together. Think about talking on all these points. Consider other industry practices. Innovate, evolve, expand practices started due to pandemic. Build partnerships. Look at actuarial risk, e-learning, wellness training. Create interorganizational partnerships and alternative funding. I have more of them in a minute. First, who am I adding? I'm adding another one. So right now we have 39 on another one, omitting another one. I'm going to stop the share for a second because I want to go to another document. So let's share the screen.
You fill it out.
Hey, Tony, how many people are we up to now?
40.
Nice.
Yeah. So it's not the one I want. Yeah, we have 40, and the comments are going. I haven't able to see them. Jonathan or Nick, what you could do is maybe couch some of the comments that we have that are important to bring up as we get started. But
absolutely, and I'm grabbing most of the comments as I can. There's an output file, but my computer wigged out for like a minute at the beginning of this, so I asked Amy to send me the introductions. Since then, I'm grabbing the comments. Thanks, Amy.
Here's where I want to go. So hopefully you can see these. Additionals that are not on that slide is change in protocol, and this is both fire and EMS, change in protocol and practices, especially for EMS, increase in telemedicine, alternative treatments, treat and stay, doesn't require transport. So instead of calling it a refusal, these people don't need it. All opportunities to change our delivery, increase our public education and our message, improve marketing and branding, create a single message, and that when we're talking to our stakeholders, external especially, to elected officials, to government officials, to our business community, to our community in general, we need to have one message. We can't have multiple messages. Years ago, and this is just in fire, I was talking to a legislator in New Jersey, and I said, you know, Assemblyman Weinberg, the fire service could use, and she says, Tony, you know what? I understand. We love to help the fire service. But who is the fire service? Is it the union? Is it the volunteer? Is it the chiefs? Is it fire? And so it's even more complicated when we got fire in EMS. So we need to create a single message. Justify your staffing. You better be, if you're not looking right now to justify your staffing and think it's going to continue, and consider alternate tasks. We looked at, and I brought up last week how the National Guard's giving out food in lines, you know, for people who need food. Another one the National Guard's doing it in New Jersey is they're working, putting the staff in nursing homes to help. So what can we do to alternate tasks for our staff to keep them relevant and continue that our return on investment is worthwhile? Build your community base, fire prevention, and EMS, all that is year round. So that's what I have so far to get us started. I'm going to, in a minute, set up my iPad and I'll be taking notes. So with that said, I'm going to go back to the original slide and put it up. And I'm going to go to the note. I can't. Gotta keep it down, sorry, but it's still there. Go to the notes and see who's ready to go first. Who would like to open up the discussion? Somebody type in there, me, who wants to go first?
Can I call on Ryan? He's quiet. I want to hear what he thinks.
Well, Josh raised his hand. Josh, go on.
Josh, go first.
Yeah, good afternoon. You know, one thing that you mentioned there obviously was some of those missions that the National Guard is assuming. And here in South Carolina, we've got some pretty widespread testing and swabbing that's getting ready to take place between now and the end of May. And one of the downstream possibilities is that as they're testing in all of the facilities and assisted living, et cetera, is a major staffing issue in those facilities. So we've actually worked in South Carolina with a temporary waiver for EMTs to substitute for CNAs in a nursing home environment. That's good for 4 months. The challenge, however, is in order to do that in a way that even covers costs, not to mention, you know, anything beyond that, the nursing homes don't have the ability to fully fund that cost. So a public-private funding model is something we've proposed with some of the federal funds that have been allocated to South Carolina.
You know, it's excellent stuff, John. And I saw an article where somebody in California is doing that too. And I think we need to look into some other alternatives like that of where we can keep our people busy. And while one of the things I didn't say, one of our goals in 2 weeks after we get through threats and start thinking is to develop strategy. So as we're going through all this, make notes or write down some strategy so we'll be ahead of it. Who do I have next? Alan wanted to go. Alan, you're up.
All right. Just as you were talking, I was making a couple of notes here. So the biggest thing I think that we're going to have to find the opportunity in is we're going to have a huge PR issue coming up. At the beginning of this pandemic, we were riding high on a 9/11-like high where everybody loved fire and EMS. Everybody loved their first responders. And we were even cheerleading each other. I mean, how many towns had fire engine parades going past the hospital to cheer for the nurses? Now, in my city, the mayor has just announced that he and his cabinet all took a 2% pay cut, and he's pushing that on all the unions. He's talking about a 10% across the board budget from the operating budgets of every department. So we know that at some point we're probably, if not this year, next year, looking at layoffs in public safety, which has always been kind of the last resort. You lay everybody else off before you go after the cops and firemen. and call volume is in general down. Although the police have had a couple of spikes in different areas, I can tell you from working in dispatch, 2 nights ago, I think we had 2 incidents that actually generated reports, but we had over 100 incidents where cops were checking empty parking lots. So they're trying to make up their numbers so that the raw numbers show up. But if anybody ever asked what these numbers are coded as, it would show we barely need a police department, which we all know isn't true. But I think we're going to find ourselves in a position where we're going to be fighting for. There goes the rescue company driving by me. Sorry, I'm out on my balcony today. We're going to find ourselves competing with each other over the same small pieces of the pie. And when you talk about geography, it's interesting because my dispatch center where I work is a municipal dispatch center. The state has been pushing for regionalization for years. And there's actually a couple of small towns that have like the same guy who's the desk officer dispatching, and they've combined due to the pandemic. So I think increasing geography could possibly happen in a dispatch sense. It's definitely not going to happen with my volunteer fire department, where we've actually been brought down in our geography over the years, and for various political reasons, we're never going to get that space back. One opportunity that we've been talking about in the volunteer fire department is a bunch of us becoming CPR and first aid instructors and running community classes so we can get people into the station to see us and meet us and provide a service that wasn't really a traditional service before.
Well, you know, the education thing's good because Nick's got some stuff when we do his graphics later, but that's a key point. And when you brought up about competition, if they're not looking at it, we need to go find our competitors and see how we can talk them into be collaborators. And I don't know that that's an easy message and it's easy to do, but we really need to be thinking of it. Instead of looking at them as competitors, we need to say, hey, how can we get you guys to be partners? And I like the CPR thing. It not only provides more return on investment for providing the service, but you actually, like you said, get them into the building. And down the road, the ways we provide training, and again, Nick's infographics will show some of that. Next up, we have Ryan. Ryan, you ready to go?
Sure, I'm ready to go. Can everybody hear me all right?
Yep.
All right, good deal. So just kind of building off of this topic of collaboration, one of the things that I think we really need to push, we don't need to wait for the pandemic to even end. We can start kind of getting together. And don't mind my dog. He's got a squeaky toy in his mouth here behind me. So one of the things we can be doing is
one thing, man. You only got one dog. Can you hear my 4? You got anybody with only one dog really is not having fun. Go ahead.
I'm going to keep it a 1 for right now. So I am on an EMS salary. So anyway, that being said, so when we talk about collaboration, one of the things I think we're really missing the mark on and where we could really come together and sticking with kind of the unity theme here is we've truly have to put all of our eggs in one basket. We've got to go collectively to DC and make these decisions. We can't wait till a pandemic hits to say, look, we're important, help us out now. We needed to be doing this prior to, and instead of having multiple national organizations trying to fight fights on separate fronts, why is it that we can't all collectively come together, put all that money in one pot and go collectively forward? And then building on top of the idea of collaboration amongst competitors and agencies and whatnot. And I hope Josh and Brian don't mind me calling them out on this call, but in South Carolina, I think one of our great strengths is that despite the fact that we have several competitors in our markets, we have found ways to collaborate and come together, which has ultimately strengthened the private sector of EMS in our state, unlike anything we've ever seen in years past. So I think we have a lot of great things, a lot of great synergies working to our benefit. But one of the areas that I think we continue to lack is that unified voice. When fire goes to DC, they tend to go all together. They make a big show out of it and they get results. And I just would like to see us doing more of that in EMS and having some of the legislative benefits that are coming down impact all EMS providers, regardless of legal entity organization.
I agree with you. And maybe somebody, as we get through this, can answer. I mean, I'm kind of part of IFC. I know Gary, but we need also some bigger organization voices, both in the fire and EMS, as well as maybe some state organizations making those contacts also. And maybe this group at some point will be valid enough to do that. But if everybody can start thinking about what strategy can we use to actually accomplish that, and what is the strategy that we can become that one voice? But it's definitely the opportunity we need. Next, I think, who do we have next? It was Nick up next? Nick, we'll go with you anyway.
All right, sounds good. Hi, everybody. Awesome to see the group grow again. So I have a couple of things. I put out some infographics for Tony to share with the group. One is some EMS alternatives, and one is some fire alternatives. I'm sorry if the fire alternatives is not 100% accurate. I'm not hopefully active with the fire department as I used to be, so I'm sorry for that. But then there's another one about securing your brand, and I want to talk about that because it seems like there's a lot of discussion today, more than there has, about securing your brand as as an agency, right? So the first thing is I really want to encourage everybody to, one, look at your mission statement. Does your mission statement align with what you're doing? And if it does, that's awesome. You can look at a couple of really different agencies, including like big brand business agencies, and see what some of their mission statements are. But Tony, I made this wheel here. That's the one. We can start with that one, Tony.
Okay.
So I'll take you guys a little bit around the wheel here. There's a whole it's a big PDF, but we'll make sure we get it out. If you have the app on your phone, if you ever want to use it for presentations, it's called Mindly, and you can get that through the App Store. I'll shoot that in the chat as well. Let me see. So in the center there, this is really great for like big screen presentations because you can see everything. So in the center, you have securing your brand, right? And then if you look up to the, let me see what we're looking at here, the top left here, where Tony's zooming in, you'll see create valuable content. We'll start there. So when you start with creating valuable content, right? I'll let you keep zooming there, Tone. I'm sorry.
I'm trying to get you right there. It's right where my cursor is at, right?
Yep. So yeah, so we'll do create valuable content, right? So the important thing that you want to do is with that, you want to display your new programs, right? So look at your new programs, and then inside of that, you want to highlight your outreaches, right? So as an organization, what are you doing to outreach to people? You know, with that content, this is what you're pushing out through your social media and things like that. The other thing that you want to do is you want to show your measures, right? Show your protective measures. Show what you're doing as an agency right now during this time to, you know, protect the community and show them what you're doing. And the other thing is to highlight your daily life as an EMS agency. You know, the one thing that I saw looking at a couple of the people on here on their pages, there's some daily updates that go out to, you know, their business Facebook pages. You know, one example I saw on Ryan's page, at Thorn, they went out and they did what did you guys do? You guys did a big move in Kentucky, right?
Yes, yeah, did a big hospital move up there.
Right, and putting that information out there shows your justification in and of itself as to what you're doing already. You know, the other thing to touch on there is show your worth, demonstrate what you do, you know, whether that be through, you know, video demonstrations, a quick how-to, you know, first aid basics. Like there's so much that you can do with this, right? Demonstrate your work, display your team. You know, displaying your team and showing your team to the people is one of the most important things that you can do, because then you attach a face to a brand. You know, now it's become personalized. Now you're showing someone. You know, it's not just, oh, look at my ambulance, it's big flashy, or look at my fire truck, it's driving by someone's house. Show your team members, show the people that are out there in the street. Really important thing to get valuable content out there, right? Where else am I? Create valuable content, tell a story. So, Tone, you want to go over to tell a story?
Which way is that, left or right?
Wow, let me look at the PDF. I want to say left.
Okay. Display your
go down.
All right.
Actually, we'll just we can just keep going. You can just pick a different spot, and I'll just start elaborating on it. It doesn't matter. we'll go with help others, right? We'll start there. Right there is fine, Tone. So we'll start with help others, and then we'll talk about support a cause, right? So you've got your own organization, awesome. But the biggest thing is, and this goes along with unity, right? So one thing that I've seen a lot of organizations do, like they partner with the Code Green campaign and push their message. Some people do the Susan G. Komen Foundation, like this stuff for a cure, and doing those fundraisers and pushing those resources like mental health resources. That's a big push for marketing right now, and not just because of it's a message and it's showing that you care. It's because you're doing it for the right reasons. The other thing is making sure that your agency is doing things for the right reasons, supporting the right causes and getting the stuff out there, right? Helping others in another aspect, you have your community service. So you can do prevention programs, your outreach programs, and that can fall under fire prevention, that can fall under, fall safety, all of this great stuff. And then you have your other outreach programs. You can highlight if you're doing community paramedicine or if you're doing, hospital readmit prevention, like highlight that stuff. That stuff can double over for you in community outreach. Go ahead and go down a little bit more, Tone.
By the way, Nick, just one thing to note, and again, I think since this theme today is opportunities, one thing I think maybe worth touching on is when you talk about things like community service and so on, as we talk about the evolution of the payment models, for example, that's one of those areas that I think tends to falls away, but maybe shouldn't. There's a lot of economic value generated by the types of things that you're talking about that don't get translated by this industry into dollars and cents.
Right.
And if we do that, then you start to unhook yourself from the established payment models.
Yeah, yep, definitely. I think there's a little bit more in my other graphics, but I won't kill you guys with those. Those I can just share out.
What we'll do is we'll share them. One of the things that I'm going to do is put up my email address at the end of this, and you all send me your emails. So I make sure that I add you in, but anything we have to share out. One of the things that you can put in your notes, do we want to use Dropbox or Google Drive or both? I'm willing to make shareable folders for all of this information, not only so you have the information, but we can collaborate in between.
Yeah, definitely. The other thing that you can do is, working with your nonprofits. The one thing that I did see here in Morristown through our fire prevention guys, they actually went and partnered with American Red Cross and held a blood drive specific for COVID-19 here at the station, so that, it's just more communication outward to the community, getting more people involved, see what we're doing. It's not, you have to get off of the typical, base of, well, we're fire, that's it, that's all we do. Or, well, we're EMS, that's it, that's all we do. You need to look at your alternatives. The other thing that I saw that was highlighted in Burlington City, and I don't know if anybody else's department is doing this, they did a free and reduced lunch distribution program for the schools right now. That's a highlight. If you can make your people, if you can make your people out there and get your trucks out there delivering lunches to kids who can't, afford lunches and meals and things like that, and getting it in the community, you can help with distribution. You can put program info pushing out there. In Burlington City alone, they had the cops out there in their cars going out and getting on their PA system and telling them where the distribution points for, free and reduced lunches. And then also going out and taking counts and tallies of, how many kids are in their grid that need free or reduced lunch, and communicating that to the school and getting those meals together. The other thing is too, you can also consider food drives. Like, you really got to look at your strategic partnerships here, because it's going to help secure yourself as an agency, because you'll be that hub for communication. To get that out to your community, because you got to think too, EMS and fire are very well ingrained in the community. Social media outreach and things like that is really big, and people look to that. So it's a good opportunity. Tony, you can keep on going. I think you can.
And I want to go, Anna Marie. Are you on? Anne Marie? Anne Marie.
Yes.
Tell them what you guys are doing in Union Titusville with the mask. I think this is very innovative. I would have never thought for fire EMS to do something like this, and how many you've distributed?
The vice president / firefighter / trustee at our department, volunteer department, is also the high school tech teacher. And he was able to get permission from the principal of the high school to let him have the 3 3D printers he had to start making masks, or not masks, make the holder for a face shield. And then we found out that if you use the clear transparencies, it makes the perfect shield part. When the Board of Education found out, they gave us all 12 of their 3D printers. They're sitting at our firehouse right now in our training room, and they're running 12 hours a day printing out these frames. And then one of the he's a college kid now, and him and the other gentleman, Michael Sullivan, they come down and they assemble them. And we've made, as of last night, 2,700, and we've distributed 2,600. We've gone every hospital and EMS and fire agency and police department in Mercer County. We've done a few in Bucks County. I work for America Emergency Squad down in Mount Holly, made sure they got some. We just sent 250 to St. Peter's Hospital in, New Brunswick? So if you just contact me, we're going to keep making these. We just got a huge donation for money, and people are sending us the filament that we need. They're sending us the transparencies we need. So it's a ongoing operation as long as possible, but it's just being done by volunteer firemen to make sure that, the rest of us are safe.
And what I believe about it, and I'll turn it back to you, Nick, is what they're doing is not only are they evolving, are they creating value in an unnormal way, but the other thing that they're also doing is going and building their partnerships with their strategic partners. So they're accomplishing several of the opportunities that we're talking about, and that's why I wanted to go there. And I'm sure all of you are doing something, or most of you are, that we can go with this. So Nick, do me a favor, let's move a little quicker, because and guys,
Sure.
Put your hands up, because I want to get more people into the discussion.
Sure. So, then there's your other things where you have live streams, like you can communicate out there. But some of the big things that I really want to talk about here are your social media presences, right? And that's where Tony's at right here on the wheel. And then I think I'll cut it loose there because you can read the rest of it. It's pretty detailed. So in here, you need to really think about social media outreach is a huge thing when it comes to our service, because people don't see us unless they need us. And that is unless there's a parade or some other community event. But the thing that you really need to consider here is, your reshares. Reshare your local agencies, reshare your positive reviews, reshare positive content, and reshare the government updates. If there's stuff coming from the government, if there's stuff coming from OEM, reshare it on your page. It will get the communication out there. But the other thing that I really want to touch on is press releases. I know that there's some agencies that believe in strong and silent, and unless, there's something good or something bad. I think that we need to get everything out there. Your press releases should include the bad, the indifferent, the good. You need to paint a transparent picture as an organization, because that's what we need to be, is transparent. Even if you're a private entity, providing service to the public in a local, area or a county, you need to get the information out there, because if you're withholding stuff from the community, the trust is not there. They see the ambulance coming, it comes, picks people up, and it goes to the hospital. Nobody knows what else is going on. Nobody knows training initiatives. Nobody knows, sentinel events when you have an accident. And typically, that's the information that goes out there. It's when, hold on one second. I see what John says. Yes. Sharing each other's initiatives. Absolutely. I think we should be sharing each other's initiatives. It's a huge thing when we get that communication out there. Unification is a really big thing at this time, especially now. Tony, if you want to go up just a little bit and to the right, and then we'll finish out this little horn here, and then I'll be done. Daily updates. I talked about this before with like an example of what Ryan's doing. Talk about your daily life. Talk about how you're helping somebody. Show your training and show what you're doing. I'll leave that graphic alone now, Tony. But there's a couple other finishing things that I wanted to do. So one, there's proof in numbers. There's some information on metrics here. Use it. Look at what I've looked at. with your metrics, how you can use them, how you can tactfully present your metrics. The other thing too is demonstrate your program's fitness. If you're looking for alternatives, look at the alternative graphics that I put out there. And this is just a base. That's just a baseline of what I thought of. But, demonstrate the metrics. You can attach metrics to just about anything and then compare it to your call volume, your healthcare outcomes. If your programs are effective, it'll impact your call volume. Like, you really need to consider that stuff. And then track your hours. In all of this stuff that you're doing, track your hours. It's going to help you justify your staffing. The one thing that we do is they make us track our hours for every single project that we do in the business world. We have to track hours. It helps us justify. We should be doing the same thing. I understand shift times and stuff, and that's cool. People come in for shifts, but what are you doing? How much time are you spending on those tasks or programs within your shift? And then the other thing is, I'll leave it at this, build your community base. Fire prevention, it's year round. It's not just in October. I see some companies, they don't do anything for the community until October comes, and then they have their huge fire prevention, and it's a month to push awareness. But, a good example I'll say of that, and I'll put it into the Unity group, is Morristown Fire Prevention. They're actually doing a video called Burn Stoppers University, where they're doing 5-minute blurbs that are, one, funny but informative to what the fire service is, what they do, what they provide. You really got to look at that stuff and get it out to your community. It's a great social media initiative, and they actually were put on the news for it, for how well it's going. And then same with EMS. EMS is a 24-hour, 7-day-a-week service. We should really be looking at, what we can do as an EMS agency. Look at your community medicine. I know we had talked, I think it was Anne-Marie actually. Was it Anne-Marie that's doing the outreaches? Yeah. So, look at those programs. Even if it's not significantly impactful to your numbers, it's still something that you're doing to further justify your position in your community. So it's something that you should consider. But we'll get those infographics out, and I'll stop hogging the airtime here. Thanks, Tony.
No problem, Nick. We'll get back. Before I put Amy on, what I want to tell you, my buddy Tagger Schmittendorf, if you go to taggerschmittendorf.com, does a lot for volunteer recruitment and retention, but he does a lot about how to interact with your community, and that every public interaction is a process to connect with your community. And EMS really could do a lot better job. But again, collectively, when I started in fire and EMS, during EMS week, we had fire and police involved. And during fire prevention, we had EMS and police involved. So we need to figure out how we can create those opportunities of partnerships in public education and public interaction. With that, I'm going to go to Amy. At some time, I see Eric Graham Chase has a lot to say. So we're going to put him on, and also Art in a while. But we'll go down Jonathan's list. But Amy, you're up next.
Hi. So what did you want me to discuss specifically, Anthony?
Nothing, just your general perspective on this opportunities and where we have to go. And I see David Moffett, your hand is raised.
So I think that in the chat and some of the marketing things that we just talked about, whether we call it marketing or something else. Yes, thank you, Jonathan. I wanted to know which thing to talk about because I could just go on sometimes. So in the chat, I had talked about wellness as one of the opportunities and wellness education. So wellness education obviously is very important. And so I started talking about EMS provider suicide like in 2013. And in the beginning, nobody wanted to talk about it. I got turned down a lot. Nobody was interested and nobody really thought it was a problem. And similarly, that's what was going on at that time in the fire service. So I know that wellness education has really had an uptick, but wellness is not just, PTSD, which is kind of how it's being translated now at large. So wellness is a variety of mental health issues. Wellness is physical wellness, and so sometimes those two get separated, but we really do need to pull it all back together. So nutrition and different things like that, which can be difficult, right? When you're working on the truck, it's hard to have that ability to do that. Also, one of the things that I've really kind of been going to town with is fatigue mitigation. And so we also talked about in the chat, you know, fiscal issues. And I think that fatigue really highlights that, right? So fatigue affects a variety of things in the provider, but also in the agency. It affects your physical wellness, it affects your mental wellness, it affects your ability to respond, right? So memory, it affects your ethical decision making. So fatigue really kind of takes the gamut. It's not just ambulance accidents. So whether we're talking about medical errors, whether we are talking about ambulance accidents and the costs associated with that, whether we're talking about long-term physical health issues, because there's comorbidity to diabetes and cancer and strokes and heart attacks and all of these different things. So later, maybe our older providers are going to cost more on our insurance. And the largest piece is that we don't really view providers as valuable, right? In general, there's this idea that, well, we'll just get more, right? But it's not necessarily that initial training time that's the cost. It's the onboarding time. It's the community experience. It's the agency experience, that history that comes with it, that history of being able to look at patients and have some experience of sick, not sick, right? So we lose those things that we can't necessarily put a value on, right? But that is very costly, and FD&Y is going through that right now, right? The providers move over to fire suppression to make more money. And so now, you know, all their providers are 5 years or younger, right? So there's a huge financial cost in a myriad of ways. And Jonathan had kind of asked about this. I worked in an agency in New Jersey, and they had a fatigue, not where I work now. So let me just clarify that. They had a fatigue management policy that you could only work 18 hours and then you had to be off for 8. Well, everybody lived an hour away. So it's an hour home, an hour back, whatever time at home of you taking a shower, doing whatever, feeding your dog, you know, taking care of your kids, making your lunch for the next day so that you can eat nutritious food at work, all of that time. So really the time sleeping might have been, you know, 4 hours, right? Which is not adequate rest. And then it kind of was a joke policy. So management and the dispatch center, which brought in overtime, they didn't take it seriously. So the providers didn't take it seriously. And then were guilted into coming in even if they felt that they needed to rest. So it's important for all wellness, not just fatigue, but all wellness to be everybody bought in on every single level. Everybody has to have this education to know what the risks are, you know, and maybe leadership needs a little extra information so that they understand the risks and the costs other than just, well, we lost another provider.
You're right on, Amy, and you know that I've been well involved with health and safety, fire and EMS, probably more than fire, but the COVID thing really gives us the opportunity to say, look, our people are working extra hard. They're under a lot of extra stress. Even if they're not running calls, running extra hours, it's a lot of mental stress. It's a perfect time to say, even more than now, and it's got to be a holistic process. It's got to be mind, body wellness, as you've talked about. And I've been doing a lot of stuff and talking with people that do yoga and other training. You're right on. It's key, and I have it definitely under here, under our opportunities to utilize the wellness stuff to improve employee performance. But the other thing it does is when you do this, employees say, you're investing in me, you care of me. And we need our employees to be our frontline. We're talking about public education and marketing. They got to be our frontline voice and base out in the community every day. So Amy, you're right on, and I got that as one of them. Anything else? If not, Jonathan's lining up my cue for me.
All right. Well, you can go ahead to the next person because I could talk about that all day long.
Well, I think
You're awesome, Amy.
Thank you.
Some breakout discussion on that later. Jonathan, Are you next, or did you have Josh or Ryan? Who did you have next?
No, let somebody else go. I'm taking notes, and I'll have plenty to say. I think this is amazing what's going on in this thread.
I got David Moffett wanted to go.
Yeah, let's let Dave go. He's great.
Hey everybody, first time caller, long time listener.
Second time caller. Weren't you here last week?
I was, but I didn't participate. Yeah, I was just on the call. Anyhow, so I'm a captain with Phoenix Fire Department, and most recently my mission was within the EMS division, and currently I'm assigned to the incident management team for the city for this COVID involvement. I'm embedded over at Maricopa County Public Health, so I've got a much broader view of the community and how this pandemic's taking place and what the response from community level is. I just wanted to contribute a couple thoughts in this, and this is just some 60,000 foot altitude conversation, in that I really like what was brought up a couple paragraphs ago from the last gentleman that was on this call about the idea of fire prevention. And not that I want to put the fire department spin on an EMS conversation, but I think it bears out here that I had a boss that thought about mobile integrated health or community paramedicine from the fire prevention perspective. And in fact, the way he termed it was that mobile integrated health is the fire prevention of EMS, which sounds silly and trite, but I want to just bear out the example there is that for however long ago that our respective organizations took on fire prevention, for mine it's probably been 40 years or more, that it was new, it was novel, it was the brainchild of a few people that had to sell it to the rest of the organization. And part of that selling point was the value in the argument of absence, in that what we were saying was the value didn't come in because certainly there are elements to it where there's inspections and penalties and all that stuff. There's a small amount of revenue that comes in. But if you were looking at it in a small-minded way, that the value from it was the trickle amount of revenue that came in, the bigger argument was where and it was hard to make, of course, but the value to the community by what it was doing, and that it was saving community dollars, right? If commercial buildings aren't burning down, then you're preserving jobs, you're preserving costs for insurance and all the associated things that don't happen, but that's the value to your organization there. To touch on what I think it was Amy just said, if you have a robust program, and I would say that first and foremost, that the conversation probably does not start with money in terms of reimbursements or shared savings models. I'm all about that. And I know that we need to look at funding streams, and that's where we build sustainability in this. But I think that the first conversation has to be, does it push the patient down the right path to care? Well, and once we've answered that question and designed a program that pushes down the right path to care, and just for a divergent conversation there, right? For different communities, that looks differently. I work for the 5th largest city in the country. I don't need to necessarily build a program where I have to train my members to be really diverse in their scope. We have to build a referral network here because our community has a very diverse and large amount of providers. And so for us, it would make sense to just push them into that there. For smaller communities and places that are more remote, it probably does make sense for those providers in those environments to expand in scope and partner with people from a response model to deliver those services, because there is no one else within the community to develop that. So I don't want to spend a lot of time on talking about what a specific model for success would look like, but I think that in however you push the patient down the right path to care, now you're on the right track to selling this to your town councils, managers, even within your own organization, if there are people within it that don't buy off on it. And that brings me back to the fire prevention model in there, is that the community benefit that comes from it, if it in an instance like this, I'm sure that to some degree, all of us on here have been touched by the conversation of what the plan will be when a vaccination comes out for COVID-19, whether you're for vaccinations or against them or however you feel about them. And their odds are that you're county public health officers are probably planning to use EMS and asking for the directors of your various health departments to create standing orders that would allow people, because for the county that I live in, which is Maricopa County, there's 4.4 million people here, and there isn't a workforce in any organization that is prepared to take on vaccination at that scale. And so I think that when you answer a few basic questions, which is, does this fit within your mission? Do you have the resources that can support it? Do you have the right authority to take on projects like this? And it's about pushing down the patient down the right path to care. Now you're on your way. I think from that fire prevention model, now it's a fairly ingrained, it's encapsulated within doctrine, within NFPA. And there, you could go back to Emmitsburg and take National Fire Academy classes about it. It's a foregone conclusion in our environment. And I feel as though mobile integrated health and the future of EMS overall, we are at this point where when CMS relaxed a lot of the rules, and for Arizona, when the Department of Health Services did away with and created new functions for EMS to exist within the state, that in a sense that toothpaste can't go back in the tube, and we should be exploiting that, and just knowing from which confines we're in, that we can build something that on the back end, when we start measuring things, works toward what Amy was talking about, is that there's member benefit involved in it, right? If our answer, so where I work, we're really, really busy. And now in this COVID environment, we're down about 18 to 20% in our call volume. But when this is done, we're going to go back up. And there's a giant disparity between the demand on the fire department to run calls, and we're a combination fire department that we're running fires and EMS. If I was to draw the graph, the line of the demand on the fire department to continually run calls drastically and disparately outpaces the growth of the fire department. And if the leadership answer to that is to just grow the fire department like we always have by buying more fire stations, more fire trucks, and training more firefighters, we're never going to do that at a scale that's going to narrow that gap. And that's where the fire prevention model would come in, is that rather than building the dam higher, we have to look at ways, intelligent ways, to lower the water behind the dam.
All excellent things. I want to ask you a couple questions to expound on it. First of all, on the fire prevention model, one of the things I want all of you to look at, whether you're fire EMS, is Nick Linden up in the North Midwest is collecting data on firefighter rescues. So when firefighters rescue patients, where are they found? When were they found? How long they were found? This data, a lot of people are just looking at it going, well, how can I use this information to be better at firefighter rescue? And I've said to Nick, and we're having the discussion, I'm going to continue, how can you take that data and go and say, how can I talk to my community about, I know where we're rescuing you, I know where we're finding you alive, I know where we're finding you dead, and these are the situations, and we want to utilize this information to communicate to you to help reduce these firefighter deaths. And the firefighters got to do it. The firefighters got to do it. So same thing with EMS. EMS, where are the calls happening? What's going? How can we talk to you about reducing illnesses and injuries? And we don't have that.
Yeah, that's called community risk reduction, what you're talking about. And that's the strategic level thinking of looking at what's taking place within your community and building programs, and when possible, leveraging other industries and other government agencies to come in and show them what you know, so that you can collaborate and get in front of public health issues.
Yeah, absolutely. So one of the things, and I hear about it, do you guys look as when you were looking to put value to your organization, which is the key? A lot of people don't spend enough time, but as you know, in other countries, fires are down a lot less than they are in America, but staffing is about the same, but they do a lot with fire prevention. Did you look at the community policing model at all to say, this is how they added value, which is the same thing? We're reducing crime. Yeah, there's a lot less crime, but you need us police on the street, because as long as we're here, we're helping reduce that. You know, we're saving property, we're saving lives, reducing losses from robberies and things. Did you look at that at all when you were looking at your model of valuing risk reduction.
So that is, I see where you're going with it. I feel like that analogy is fraught with peril in that some law enforcement agencies, the culture there is so different that they define crime differently. And so I don't want to get political about this, but let's just, and I think we all have
Feel
seen.
free. We don't mind.
That's okay. Let's say San Francisco, for example. If you're paying attention to that, I personally, my conviction on that would be that we don't make the homelessness a crime. You know, things like maybe camping on streets and stuff, that you probably should redirect community efforts toward, I guess, preventing homelessness would be the smartest way to talk about it, but that's an awful big bite. But what you probably should not be doing is raising the dollar amount for theft to $1,000 and just say, well, my police department's too busy and we have other priorities. And so if someone breaks into your car and steals something out of it, or into your house or into your business, and it's less than $1,000, we're just too busy. And so that's the threshold. Well, the next logical conclusion to get at is when they get too busy again, then that's the next part that erodes, is now they raise that number to $2,000 or whatever that is. That's why I'm a little less comfortable using the law enforcement analogy, is I just don't feel like that's responsible policing personally in my sensibilities there. Right. But I see what you're saying, right? There are analogies that exist out there that can be used. I think some of them work better for us than others.
Right. And what I like you did is, hey, fire prevention and EMS can use the same model, just a little bit differently, which is good stuff. And I'll let you go. But the other thing, like I said, the big thing, one of the things you said about and the same thing goes for fire prevention, but with mobile integrated health, which I've always understood it to be, is integrated with your community, and you should be looking for those partners in each community, who those partners are, whether it's alcohol or drugs or mental health or wellness, whoever those partners are. And you know, Obamacare, whether you like it or not, formed accountable care organization capabilities to do those type of things, that whether it's fire prevention or EMS prevention or reduction or well-being, we need to form those partners, and that's the key thing in the opportunities. But it's so many different things we could use those partners for. So it's a great point. And I was told to pick on Helen next. Helen, you're up.
Hi. This is amazing. This is my first time. Thank you, Jonathan, for inviting me on this call. Amy had made a comment that Jonathan,
Glad to have you here.
I can't remember exactly how it was phrased, that we don't worry about our providers as much as we do our patients. It's in my comment back in the chat was that at our agency, I'm the manager of our community paramedic program for Durham County EMS in North Carolina. In our program, or for EMS in general, we have put a strong emphasis on our providers over our patients in many cases. True, we're going to still do our job. We're going to take care of our patients. But we've taken a lot of steps to make sure that our folks have the proper PPE, that they don't go into scenes until they have that PPE. And if they don't have it, they're not going in. Like everybody else, we're checking temperatures, we're doing vital signs. But we're putting a strong emphasis on our providers. And we've got mental health in play here. We've got a person that's contracted that comes in and checks, well, he's doing mostly telehealth right now, but he comes in at least once a week to check on all of us. We have a peer support program that I'm the coordinator of, because I'm also a licensed counselor as well as being a paramedic. So we're doing a lot to help our providers, and Jonathan wanted to make sure that I mentioned that.
Well, you know, I wanted to bring up Helen. First of all, I guess you had to tolerate that Jersey guy, Skip, for a while.
Yes, we did.
Skip started in the county that I'm in now. and I used to teach with him before he became an attorney and then became world renowned. Now we just harass him on social media. But I have family in Wake County, so I understand that in the Durham, Wake County area that you guys are very progressive. A lot of people can learn and pay attention to what you're doing, not only on the streets with patients, but what you're doing with and for your people. And as we've had 2 or 3 people, we need to make sure that's one of our weaknesses, but we really need to make it an opportunity to take care of our people, and it will improve our performance and visibility in the community in a more positive light. But as Nick said, I think we need to highlight that. When we're doing good wellness programs for our people, we need to get out and let our community know this is what we're doing for our people, because your community wants to hear that you're a good employer or you're a good volunteer supporter. If it's a volunteer organization, whether it's fire, police, or EMS, it's a great thing. And again, I'm sure you've had some involvement with Dina Alley with your peer support.
Mm-hmm.
You guys
Yeah.
in your state have done some great stuff with that. So it's definitely some good stuff. And I have that on the list. What we need to do in 2 weeks is, again, keep in your mind how we're going to talk about in some general and local ways of how to use the strategically use that to our benefit. But there's no better time right now to talk about making our people better through health and wellness. And for me, I can tell you in 2 weeks, I'm going to be doing something with Shannon McQuaid and Troy Powell. Troy's a firefighter in New Jersey. Shannon McQuaid teaches yoga and has Fireflex yoga, and we're going to be doing something online about that. So, we have the ability to do some great stuff with that. John, who do we have next? Call on whoever you have next, Jonathan. Jonathan?
I think that's going to be me, Ron Nichols. That's what he put in the chat. So I've talked to Jonathan several times over the last several months. So kind of give you since I'm kind of new to the group, I'll let you guys know. So I was the director of a small rural EMS service in Southeast Texas, Chambers County. We had a small service population, about 6,000, and we created our community health program there. Recently, prior to COVID, I got promoted to the director of emergency services for all of Chambers County, which is 670 square miles.
My condolences.
I'm in charge of 3 EMS services and about 12 different fire departments, most of them volunteers. So it's been quite entertaining during the COVID to deal with all of that and start a brand new EMS. I was also tasked with combining 3 of the EMS services into 1 county-operated EMS in the middle of the pandemic. So that worked out pretty good too. But the reason I've been talking to Jonathan is when I was in Winnie, I instituted our community mobile integrated healthcare program there in Winnie, a small rural community, low access to healthcare. We've got a clinic in town, closest hospital is 45 miles away. And I was just kind of emphasizing what David talked about on using the fire prevention model. When we started our program, we took the fire prevention model and created our program based on that, utilizing that for a fall prevention program. The first thing we did was create a fall prevention program, which, depending on what state you're out of, Texas is really big right now on fall prevention and safety. So it was something that was easy to initiate, didn't cost a lot of money. But we did the fall prevention program, and just by doing that and starting that allowed us to make contacts with other organizations to start providing us funding opportunities with safety rails. We had contractors in town that volunteered to build ramps. We did all those things doing the same type of fire prevention stuff to get the word out that way. And that's how we started our community paramedic program, which now includes a mental health program. It now includes the hospice program, where the hospice nurses actually call us to go check on the patients so they don't have to drive an hour to come check on their patients. And we do cost sharing analysis with those companies for doing all of that. So just by using the fire prevention program like David was talking about, we were able to create our fall prevention program and continue to move our program forward. Now we see an average of 14 to 18 patients a month. Our fall prevention has reduced falls by almost 26% in the last 2.5 years. We also have partnerships with nursing homes, hospice, home health, and all of that all stem from just creating a fire prevention program, or utilizing the fire prevention program to create our fall prevention program, which led us to make other contacts, which helped us build our program up. Right now, as prior to COVID, we got another grant for $187,000, and this is for a small 501c3 private EMS service. We got another grant from a local foundation, the Moody Foundation, of $187,000 to expand our program across counties, to another county, to 2 other towns that are close to our town, and also have last year revenue from the program was outside the grants was a little bit over $68,000. So keep that in mind as you're building your programs and you're doing those things. Is the fire prevention stuff. I know we fight between fire and EMS sometimes. We don't always get along, but their fire prevention program is a great tool to use as you're building your mobile integrated healthcare program to give you that access to care and build those things to where you get what you need out of it.
You know, outstanding stuff. The first thing I'm going to say is, David, Helen, and you, if somewhere along the line exchange information, and as we're looking at strategies, you all have some stuff common, but a little bit different of how we can really leverage that community interaction. I actually went to a fall prevention program back in 1999 in a hospital, and it immediately said to me, damn, let's move this to fire and EMS. And besides advertising that, and I'll ask all three of you, besides advertising that as a program that we can bring, like putting in smoke detectors, are you like, okay, I get in a house, whether it's fire or EMS, and say, here's some fall prevention. I see your rug is slippery. It needs to be tied down. Your railing's loose. Maybe you want some reflective tape on your steps. And oh, by the way, what kind of medications you have, because that's part of the at-risk profile. Do you, when you go in for an EMS or a fire alarm, you have your people look and scan for opportunities to make an interaction that provides added value?
What we did on our side is all of our medics were trained to look for those things, and then as they run. Now, obviously, if it's a high acuity call, they don't do that. But for the lower acuity calls, most of our service started out with internal referrals only, and that's how we did everything. So we trained all of our medics to kind of look for those things, and if anything was out of place, they were told to put a referral in the system. Yes, it caused our initial MIH paramedics to have to do additional calls, but it helped build the program. And then, be honest, by just doing the internal referrals, as we did that for about 6 months, within about 6 months of that, we started getting the external referrals because Mama Jenkins talked to her church group, and 3 people from her church group got the contact information to call us. And the community spread outside of it after we did it for about 6 months is where our call volume actually, our program started to take off, because the community got behind us by us just doing it. We didn't really do a lot of advertising, hardly at all. You know, we're a small rural town in Texas. Most people don't even have Wi-Fi in their homes. So unless they see it on the news, they ain't gonna know about it. So for us, it was that viral spread and that house-to-house, person-to-person contact that helped us move our program forward, because of it being a small rural community. It took a little bit more time by doing it that way, but it also helped us build our program out, where we make sure as we move forward, we had the personnel to do it, and we also had the contacts to do what we wanted to do for each of those citizens. And it, like I said, it starts by just doing a simple home survey as the medics went into the house to do whatever that 911 call was, whether it be a fall, whether it be a sick call, whatever. They would do just kind of a mental survey. We created a separate document with inside the ESO, which I know most of y'all aren't fans of ESO. I'm not either. So that's one of the reasons I met with Jonathan. But anyway, so we created another document inside the ESO for them to do an internal referral. Referrals went to the MIH paramedics and myself, and then they would go out and schedule those appointments to go do a full home safety check and run them through the process with medications and do a full mobile integrated healthcare visit. So that's how we kind of built our program out that way.
Wow. There's nothing like grassroots. And what I would say to all of you, if you're not talking to your firefighters, to your EMS personnel, or whatever they are, career volunteer, about making added value simply by the way they interact, and that they're not there for just a clinical situation or this is a stupid fire alarm, but to build those relationships in your community, because they're the first ones there. I'm a big fan of Patch Adams, and actually I just put in for one conference, I'm going to put another, of people are patients first, the Patch Adams perspective on EMS. But, you know, we all should be thinking about making sure our providers understand that they are a key to our success. And it's more than just what do you mean, ma'am? You called me at 3 o'clock in the morning for abdominal pain. and making it, hi, how you doing? And looking around and scanning and making it the best interaction possible. That's some great stuff. Jonathan, who do we have up next?
I believe Anthony. Next up into the what do we call it? The pit, or up to the
Right.
next contestant. The next contestant is Josh Watts.
Oh, I hope you like my humble surroundings.
Oh, Anthony. There you go. We'll do Anthony and then Josh.
Oh,
Yeah,
I thought you said me. I'm sorry. I'll hold on.
No,
Come on,
you're
Anthony.
good, Anthony. Good. What's behind you, though, man? I've been trying to figure out what am I looking at here? I'm loving it.
It's a picture of a cathedral.
I feel like I'm in the cathedral. This is amazing.
There you go. There you go. I could switch it out. I was on a call the other day. I put a snowstorm behind me because they said that after all this, I just want to go back to the old weather days. Weather emergencies were a lot easier to handle.
I'm clearly no longer the biggest nerd on this call.
There are a couple things. A couple years ago, and I'm not in field operations anymore. I'm more training, policy, and administration. So otherwise known as an old timer or a fog. But anyway, there are a couple things. As an academic, I looked into what it actually means to be fit for duty a couple years ago. And fitness for duty has emerged as a variety of terms, but there's the legal, the social, the community-based. I looked at it as true fitness for duty. What does it really mean to be ready for doing that? And I really did, and I'm a big guy, and I realized that fitness for duty really amounts to treating public health professionals and public safety professionals both as really occupational athletes. And the reason I say that is not that I think everybody should be fit and trim with 36-inch waist and, you know, the whole 9 yards of the stereotype for men. For women, don't go there. But the issue came down to nutrition, sleep, and conditioning, both physical and mental, to be able to actively respond. So it is not an issue of mental health. It is not an issue of behavioral issues. It is not an issue of good or bad decisions. It's a combination of all those issues. Some are symptoms of a broader issue. Some are just simply failure to maintain a personal wellness. And we do very little to train public safety professionals in personal wellness. And I've been in emergency services for way too long. It amazes me that we don't talk about nutrition. We don't talk about salary. We don't talk about conditions of employment when these are all factors and indicators of fitness and readiness for duty. The other thing I wanted to point out, unrelated to that, but secondary to this conversation, is it has long been my opinion that EMS is slowly emerging as the community public health agency. And I mean that from the perspective that if you go prior to the 70s, there were clinics and community public health outreach services and clinics provided until the funding was minimized. And now we have FQHCs and other programs, but there's still that void. So community paramedicine and community-based EMS in general, because I think there's stuff that BLS can do in community recognition and awareness, is starting to emerge as a service and opportunity. And I think that's going to continue to grow. I think more and more, besides the pre-hospital traumatic care, we're going to be called on more and more in EMS to provide community-based wellness. And somebody pointed out wellness checks and simple hazard profiles within the home and residential threat profiles. I think that's a place for us to go. The question becomes revenue and opportunity. Because if you start to do the services aggressively, there's a cost factor that's more than just writable off as community outreach, if that makes sense.
Well, and we've already had some answers on finance, but a former Jersey guy another Jersey guy moved on, Dan Gerard, has an article out on how in Alameda County, how they're funding their mobile health care program. And the other opportunity we have right now, CMS is being flexible on the ET3 programs we again have to, as people said, we need to get to Washington and tell our legislators that CMS needs to make ET3 not a pilot program. It needs to go in place right now, and that funding has to be permanent. It's going to be one of the ways. I don't think anybody here that's providing mobile health care or community paramedicine will disagree that we're saving insurance company CMS hundreds of millions, if not billions of dollars, if we built this out across the country. The people
Well,
and
I think it has to be a sustainable funding source, not a grant, grants are seed money, especially federal grant money, or seed money at best. It has to be a sustainable billing cycle. Many insurances will not allow to bill because, first of all, EMS is not a licensed agency. It's a certified agency in most states. And there is a strong lobby against you. I think, my personal opinion. I think that where it has to come from is relationships with hospitals, relationships with practitioners, and the ability to bill. And that has to be stronger. There has to be a stronger pursuit for that. That will allow the resource to professionalize both salaries and conditioning of public safety professionals, EMS professionals in the field. At least that's my opinion. There's a track there in my view.
Well, I think as we get later into strategies and we look at threats also, that more discussion needs to be, but we've had at least three people talk about it today. It's really a great point that we need to discuss and build out, because we know in EMS, but the other thing you brought in partners, how many people know, and I'm sure most of you here, but in general know that hospitals are penalized with the 30-day rule, with 30-day readmissions. My wife was doing that for work. There's a ton of money being made by reducing. So if we know where there are opportunities that hospitals could utilize our help or other agencies could utilize our help. And, I think that we can start building it, but we got to have more of a continued conversation with that. With that, I'll move on. Jonathan, who do you have next, or you want to go on? Because we've talked too much about wellness for Jonathan. I'm picking on him.
No, quite the opposite. I love the idea that the fact that this conversation is organic. I'm going to let Josh go. Josh, you still there? I know you're moving.
Yeah. I'm driving, so apologize for whatever may show up in the camera. I'm not driving, I should say. I'm riding.
Okay.
But there's been a number of things going on in the chat, and I want to be respectful of folks' time. Is there a specific topic? Some of the stuff that is coming up just now. The readmission piece. I'll tackle that a little bit. There are a number of programs that have built funding on that model from an MIH perspective, but our agency does about 85 to 90% hospital interfacility. And some of the frank conversations we're having with hospital CEOs and CFOs is that the funding for that type of program through readmission reduction, the pendulum has to swing to where it's more valuable for those patients to not come in than it is for them to come in on an aggregate. And there are a number of hospitals from different banners, if you will, different corporate structures, both private and local as well as large, that just, at least to them, haven't seen that it's worth more money to keep folks out of the ER than it is to have them in. And that's one reason why we see that potentially as a challenging long-term funding model versus a reimbursement. Actually, that's the wrong word, and I'm gonna strike that word. A compensation for the value delivered by the program.
Cool. And I think we need to, as part of both the threats and the opportunities or the weaknesses, is to look forward and see how we're navigating that and keeping communication with the people in the hospitals and whoever funds them, to keep in communication to say, where's this going? How can we partner? What trend do you see you working in, instead of us making assumptions? Great points.
Right. One other thing I'd add is that, there's a lot of focus on telemed, and I'm sure some of the people on the call are way down the path of utilizing those types of things. But one challenge I would have for the group and for the industry is that we shouldn't be looking to how do we insert ourselves into processes. I think that's a dangerous way of looking at it, because one of the problems with healthcare is efficiency or lack thereof. So I think it's really more about are there places that that our specific skill sets or relationships can be additive rather than kind of stepping in the middle of. And we've been challenged because we're looking at telemed and how we can be a valuable part of that conversation. But in several several cases when we did a process flow and looked at what was going on, it wasn't as easy to see where the value is brought, at least not on an every interaction perspective, say with a nursing home that's looking to do telemed or otherwise. But again, Jonathan, I don't want to take too much time unless there's something specific that was from the chat or our previous conversations you wanted me to hit on.
Yeah, Josh, we'll bring that up again, but I do see some areas where, not in the sense like I did 2 telemed doctor visits. Obviously, that's not where we belong, but where I see is 911 call centers like Houston's doing with, hey, why can't we start actually when people call in and text, instead of having text, look at them and FaceTime on the phone and talk to them face to face. Also with our regular repeat customers where the hospital and the healthcare system is failing, why can't we telemed with them? And if we're not visiting with them,
right.
There's a lot of different combinations that we have to just explore, and some are going to work and some aren't. But if we don't explore them, I don't think that we're going to find out what full potential is. I'll leave it at that. Jonathan, you're up. Who you got next?
Hey.
You up?
Sure, I'm gonna jump in on a couple things here, and I'm gonna try to channel Art Grew a little bit, which is generally a bad idea. I don't think I can come close to phrasing this the way Art would. But a lot of what we talked about today, and the theme today, of course, is opportunities, right? And next week is going to be threats. And one of the things that's funny about SWOT analyses is that, as I think you very well identified, Tony, when you give the recap of the last couple sessions, is that the lines aren't neat, right? The strengths become opportunities, but along with opportunities are weaknesses, are threats, and so on. So it really is kind of a cloud more than an easy delineation. And Art mentioned a couple times about the walls between associations. I happen to know he and I agree a lot on this, so I don't mind speaking on it. But I think, as Ryan pointed out, some of the associations, as Eric identified, the idea, again, the topic of EMS on the Hill has come up today. There are a couple themes that I hear emerging in the conversation today. One is, again, the sort of distinctions without differences. Another goes to education. Thanks for being here, Anthony. Another goes to things like education and readiness to jump on the opportunities that are presenting themselves or that need to be advanced, right? When you're talking about things like ET3 or the phrase, again, I hate the phrase reimbursement. I think it's stupid. You're not asking for people to, or shouldn't be asking for people to pay you back for what you've done. You're asking to be paid for a job well done, right? The word reimbursement has a meaning. So assuming that you want to be compensated for your efforts, you should be compensated for your efforts, not be, hey, I expended a dollar on this, or I used a needle, I used a saline bag, pay me back for my saline bag. Well, all right, but how about the work we did? So this is where I do think, as Dave pointed out, as Helen pointed out, things like community paramedicine become an interesting opportunity to look at value. But the question, and I think this is kind of I'm glad this is recorded because there's no way I'd think this cogently if I was even writing it. I think when Amy talks about the importance, and Helen also talks about the importance of valuing ourselves, right? That if we're going to talk about being paid for value, we should also make sure that we are valuing our own people and our own efforts and our own education. And, again, I think it's come up in a couple of conversations that I've had offline lately about the types of t-shirts that people wear and you know, someone mentioned to me yesterday about a bumper sticker that essentially says, I Narcan your honor students, you know, and while I think there is a necessary part of this industry that is dark humor, it is a very important defense mechanism for the crap that people see out there. It also speaks to the inside outside messages, right? And so going back to the concept of an opportunity here being a united front, and I don't want to sound hokey, because I'm not trying to, but I think there is an important lesson to be had there. Last week, for those who are new here, one of the big takeaways was this concept of a hashtag, a slogan, united we serve, united in service, unity, right? These are messages that denote a common set of threads, and internally we're going to obviously disagree, right? Different areas. I mean, it's funny because I can see on screen right now, I see Josh and then I see Helen, and you know, you guys are in adjacent states, and not everything in North Carolina and South Carolina agrees, right? There are differences, and that's okay. But at the end of the day, there are clearly overlaps, right? And you know, you've got folks who've moved. You know, I think Ryan is a wonderful voice in this regard because he's moved from New England to the South. So understanding sort of the idea that there's clearly you can pick up in one part of the country and pick up and do very well in another speaks to the fact that there are underlying themes. And it has jumped out at me like I didn't expect. On this call, we were talking about opportunities. I thought we were going to talk more about telemedicine and ET3 and HIEs and, you know, kind of the geeky future looking stuff. And I think it is remarkably telling that the opportunity discussed. Okay, nice, Ryan. The food's really good in the South, man. I'll just throw that out there as a plug for the South versus New England. I think the fact that the opportunity has focused on this call on taking care of ourselves and each other is enormous. Like, one of the things that has come up to me in a couple conversations as I've been dealing with COVID from a technology perspective is I have asked, and again, Dave had to jump and Mike Touchstone had to jump, but I don't know if Terry made it on the call today, but those are three of the folks that I've talked with over the last 2 weeks or so about whether or not there exists an electronic health record for EMS and fire providers to monitor themselves over their career. And the answer has been absolutely not. Like, it doesn't exist. Right. So I don't, not to give away an opportunity, but there you go. Like, the idea that we spend so much time and effort taking care of, you know, talking about things like EPCR and data and health information exchange, and yet EMS and fire providers are some of the worst patients any of us will ever see. And everybody on this call knows it. Right. So, you know, whether it's lack of sleep or, you know, 12 hours or 24-hour shifts in rapid succession, or not eating right, or smoking, or whatever it is. And it's so interesting to me that the opportunity here, it's mentioned a couple times, is, you know, if you don't take care of yourselves, how are you going to take care of anybody else? And at the same time, if you do take care of each other, it's going to take care of the business. Right. And so I think that is a very remarkable theme. And it also lends itself to the breaking down of the walls. So I want to come back to that. That's sort of where I said I was going to go with this. Right. Nothing of what I have just said is unique to EMS or fire or public versus private or ground versus air or BLS versus critical care. Right. The idea of things like scheduling and education and mental health, you know, I'm sure everybody on this call was affected by the stories of the suicides coming out of New York City. But it's not just New York City. I saw something today from Ed Moreland out of Philadelphia, who works for a private ambulance service now and has worked in third service, about the Muddy Angels, right? And the idea that I believe that was this week, or would have been this week, right? The bike ride in honor of those who've fallen. And you know, one of the stories that Dave Moffat told me a number of months ago now, that really affected me, was of a friend of his who got injured on the job, got prescribed Vicodin or some equivalent, and a year and a half later died of overdose. This is someone who was a firefighter, right? I mean, not a junkie. This wasn't somebody looking out for recreational meds to get a fix. And none of those issues are limited to any one service. So why is it that we don't have this cross-cutting conversation? If there's nothing else that could bring together IAFC I chiefs, IAFF, AAA, every state association, and NAEMT. I'm going to leave some out. And NEMSMA, right? The NEMSI, take your pick. You got the state organizations, you got the federal organizations. It's the idea of taking care of each other. Someone here, Amy is mentioning Brian Fast, who I think is a huge voice that I wish would be on this call. Like, obviously for so many reasons. Bruce Graham too, by the way. We've lost some really, really amazing voices in this industry who are very much about taking care of ourselves in order to take care of each other. But it strikes me that that is one set of themes that you could put every single association on a board and say everybody here can at least be united about the need to take care of each other. And yet so much neglect happens in the interest of taking care of the patients. It's not a bad thing to take care of the patients, right? That's a great thing. But how many organizations are taking the same amount of effort that they're focusing on, again, EPCR and safe rigs and community outreach? How about community inreach, right? And I think this is, Amy, you've touched on this. I'm probably gonna pass the mic to you any second here, but I think you've mentioned it a couple times on this call, and it's something that doesn't get enough play. Ryan has mentioned it. I know Josh does this. Josh, you do a wonderful job of telling the success stories of your people and focusing and sort of doing your nightly talks and engaging on social and whatnot. But how many organizations take the time to take the pulse of their own people and make sure they're okay? And it struck me as really telling when Amy at the top of this discussion said, she worked at an organization that did that and yet didn't enforce it. And so to what degree is that something that needs to be a common thread across every color and every patch and every state and every service, no matter what size, that if you don't take care of yourselves, you can't take care of anyone else. And that becomes the basis for a united front. And then I think what will happen is you bring all those people together around the context of provider health and wellness and safety, and we'll all find that maybe we do have more in common than we have apart, than we have, different, which becomes a way of reaching across the aisle. Again, I don't want to sound like a Pollyanna. I think there's a lot of work to be done. And these organizations, yeah.
So, Jonathan, let me give you some perspective. Fire does a much better job than EMS on health and wellness, but still nowhere near where it should be. And I'm talking about health and wellness, mostly physical, more on mental because of suicide. EMS is coming up. However, I look at this as a three-pronged process. One is the health, the physical health, the physiological health, the mental health, and it's kind of part of the mental health, but the interpersonal relationships, the support of the person as a person, those three things all need to be combined. What I find in the conference is, unless you're talking about one of those things specifically, and it's really a bad thing, like talking about suicide instead of a preemptive mental health, as I've been doing with a lot of people, they're not sexy things. Both fire and EMS want tactical stuff to talk about or high-level stuff. And if the conference that I just was at in March, if you all figure, I don't want to say anything about it, but if you look at the list, and I talked to the guy around it, the list of the things they want, we're not talking much about providers and the how to take care of them physically, mentally, and as well as that emotional, professional development support. I'm not sure exactly how to catch, but when I brought up doing those classes, they didn't sound sexy enough to them. So I agree with you, and it is an area where we could unite, and obviously will be one of our top strategies that we'll get to. But I just needed to think about that. Right, Helen, resilience and toughness. There's a lot of stuff going on that we need to get when we put the strategies together, we need to put something together that provides a unified front, because being in both fire and EMS, I see where a lot of the stuff bleeds over. It's not fire or EMS. We need to work on those type of things.
But let me tell, if I may, Tony, let me tack on to that, because I think everything you're saying is incredibly real, right? And this idea of sexy or again, like the messages by which we tear down our industry is just remarkable to me. Again, wet stuff on the red stuff, or if you want something broken, give it to a medic. Like, there's so many things that we do that are, again, I think, on the one hand, self-deprecating, and again, like people saying, well, I'm not in this to be a hero. Okay, but you're also not interested to have, in this to have people look at you like you're a commodity. I mean, there's a middle ground between those two things, right? Self-deprecation internally and self-deprecation externally have two very different effects in the eyes of the public. But I think there is something to be said for people understanding the risk that, again, I'm not a medic. Everybody here knows I'm not a medic. And I have found on some level kind of much ado about semantics when people in the media use the word ambulance driver, right? I mean, some people get really up in arms about it, and yet other people point out, but we do drive ambulances. It's, there is that. And so I think there is a message to be emphasized in the idea that the work is hard physically, the work is hard mentally. There is compartmentalization that is trained when it comes to trauma. There are clearly people who are put out in the midst of the COVID crisis or drug dens, and they don't have the mental fortitude to do that. And I think one of the things that is in fact, the word that Ed Moreland again used, I'll have to tell him, I quoted him a couple times, was scar tissue, right? If you don't have a lot of scar tissue and you put out in the front line, we see this in the military all the time. I mean, PTSD has become a very forward-thinking conversation because it's just a reality, and you come back broken, and then not only are, is that not what you signed up for, but you're also no good to the service, you're no good to your family, and so on and so forth. I think one thing that I learned early on in my time here that surprised me, and I've written about it. I'm happy to send to anybody who hasn't already seen it. Some of you probably have already seen it, but it was an article based on work from Brian LaCroix and Pat Songer and Monique Rose. So some of you guys know those names. They presented at the International Association of Community International Roundtable on Community Paramedicine, a number of years ago. I think it was like 5 years ago. And I wrote an article called Heroism is the Same, but Coping is Different Over Time. And it touched on the nasty effect that is being observed among community paramedics. So the reason why I'm mentioning this, the nasty effect with respect to post-traumatic stress, because folks who sign up for EMS with the idea that you're going to deal with trauma, and you're going to deal with fire, and you're going to deal with rescues, and you're going to deal with that stuff, and are not conditioned to the idea that you are going to watch your patient die after you've gotten to know them, right? Over 6 weeks, 6 months, a year, maybe more, right? The conversation about pulse is thankfully starting to come up, and we can talk about that more another time. But
Jonathan, I just want to interrupt or add to it. It's all about our onboarding, our mentoring, and that whole process that is related to what you've just said, at why people are becoming disenchanted. And it's one of the strategies we need to talk about, this whole thing about people, how we properly onboard them, how we tell them the truth. But it's not only the onboarding, it's how we recruit them. If you recruit fire and EMS people to say you're going to put out a fire, save lives, and cut people out of cars every week, and in reality you're going to answer fire alarms and go to Mrs. Smith doesn't feel well or is emotionally upset more than anything, if we're not telling them that, then we're putting them in a situation with unrealistic expectations of what the job is.
We are, but I want to push on that a little further, because I think if we make it all about recruitment and education at the front end, I think we let ourselves off the hook a little bit. And again, I not to pick on Josh. Josh, how long have you and I known each other? Geez, like 8 years now, something like that. Right. And when I think
that's correct.
Something like that, it's been a long time, right? And when I think about the evolution of your business, your company, right? Your company is not the same as it was when you and I first met and had coffee many moons ago. And so I think one of the things that I find fascinating, again, for another time, we can talk about this probably next week about education and the actual rotational training process that deals with EMS because of how you onboard people during the course of the year. But the reality of evolving an industry means that you will have folks coming in that you can train at the front end, Tony, and lay out their expectations, right? But you also are going to have people who've been in the business for 30 years who are now dealing with things they never dealt with before. And there isn't a process laid out in any standard that I've seen, and believe me, I've been looking, to say, how do you bring in folks who are used to dealing with trauma? They have got that scar tissue, right? They are used to the idea that you're going to go into places, you're going to see kids neglected. Okay, we know how to deal with that. You're going to see arms ripped off. We know how to deal with that. We're going to see all kinds of, you're going to see plane crashes, right? This is gory stuff, but we know how to deal with that. But no one ever trained me at the beginning of my career or at any point in my career to watch somebody need an end of life document, because when I started in my career, 72 was the lifespan, and now it's 95. And you're seeing cancers, not only among yourselves, but you're seeing them among your patients. You're seeing them among people, you're seeing people fall off the earth with ALS that you never had to deal with before because people didn't live that long, right? That is it is the dirty downside, by the way, of wellness, right? Amy, I think this is an interesting point worth talking about, that the healthier you make people, the longer they live, right? Presumably. And the longer they live, by the way, you want to talk about wages? We should talk about retirement. Right,
well,
not just pensions.
So the healthier we make people, or the longer we help them live, doesn't necessarily mean that they're healthy or living good lives or lives, right? Like, so you could live to 95, but if 20 of those years are in a nursing facility, that's another thing that, when we saw our grandparents growing up, right, they were at home or they were active, and then one day they just died, right? We didn't have to see them in a nursing home or a facility.
That's right. And so this is why I mentioned, because I think resiliency is a really interesting point. And Helen, I think you mentioned something, you mentioned you teach resilience where in your process? I saw it in the chat. It's a bit up. Was it in academy?
In our academy when we onboard people.
See, so that's sort of my point, right? It's better to teach them than no time. But how about the folks who've been around for 15 years, right? How about the folks who are at the leadership level, right? I mean, it is not, again, it's not been lost on me as I see the line of duty death things come out every day. Again, I don't want to view this as a threat or a weakness. I think I'm talking about this during the opportunity section because I think it's an important one. But, the idea that,
I add provider.
Yeah, I see that.
Yeah.
I'm glad you did. I think that's a topic that needs to be discussed. And again, look, with enormous love for Brian Fass, and I think the world lost an angel in him, and he was doing amazing work. But so much of what he was talking about was it was important in that it was talking about physical fitness and keeping your health aligned, and a lifestyle as opposed to a diet and that sort of thing. But again, the thing that I try to do, because I'm a technology guy, I don't have a patch on my arm. So I try to float between different places, right? And one thing that I've always found is it's both interesting and disconcerting at the same time, is that you could have this conversation about, from the International Roundtable of Community Paramedicine has not been replicated at other places, right? Other communities need to hear that. But unless you went up to that meeting when it happened to be in Canada, you probably haven't heard this. And how many messages from the South Carolina EMS Symposium or the North Carolina Admin Conference get talked about in California? But they're essential because everyone's dealing with this. And that, I think, is, again, with sort of kudos back to Tony, because I think everybody on the, Tony, a round of applause to you, man. Like, this was your idea. But I mean, it is a remarkable thing. And it's why when I go online, and some of you know that I play this game with the industry, and I poke the bear. And someone told me yesterday, my God, the greatest book title ever, Sacred Cows Make Great Hamburger. I love that title. This idea that we need messages to get out beyond the local community, but we don't have that. And what you've created, Tony, is that. A setting where there is no recognition, again, no recognition of rank, no recognition of type, right? We are on this because we have a mission orientation, And you have had some very small departments and the 5th largest city in the country represented at the same time. And I think this is the answer to that. That is the opportunity, is every bullet that you put on here, everything that's in this chat, we need to spread this thing as far and wide as we can, because it doesn't exist now. It wants to, right? But again, AAA has the word ambulance in it, right? I think Josh did a remarkable thing in correcting me, and I've been trying to do this consistently, in not referring to fire EMS anymore. Mobile medicine is a better theme, right? Everybody on this call and everybody that we know that even if you're a fire service, unless you are a non-medical, complete fire only, which I can only think of a very few agencies that do that anymore, right? Medicine is an underlying theme. We do not have anybody on this call representing police services. We need to. Right? That's a very important part, especially now as we're looking at COVID. First responders sometimes are wearing blue, not white or red, right? So we need to talk about that at some point. And again, it's talked about in terms of the messaging conversations and sort of the public outreach. I think Nick did a wonderful job in pointing that out. But I hope this becomes, you know, and Amy, I'm going to kind of look to you because you are, you know, the social media queen. But enabling this message to run as far and wide as it can, in the nothing that if we're talking about taking care of each other, that unity concept, that is not restricted by any means to one service or another. That has to do with the discipline, and it has to do with being willing to get out there and run toward the fire and toward the crisis and toward the pandemic. Like, I'll tell you guys, I have a degree in religion. Some of you know this. It's the part of my job I actually do more than anything, which is hilarious to me. But there is an enormous amount of faith that goes along with being an emergency responder, right? It takes a very special type of person to run toward the crisis. And if we can celebrate that across its colors, then Ryan, I think your point, and I don't know if you're still here, hope you're still here. Oh, yeah, I don't know. Okay, perfect. So, you know, because again, I think, you know, you did a great job of sort of listing out some of those organizations and harping on this idea that these different colors need to come together. But this is a theme that everybody can latch onto. And my goal, if I had to paint one for the future of this initiative that Tony, and I'm going to give you the kudos, even if you don't want them, I'm going to give it to you anyway. It is to sort of funnel all of these different efforts into an overarching organization that is a massive tent, and recognizes that there are some themes in here. Pulsed is one of them. Provider wellness and maintenance, as you say, is another of them, that do not need to belong to one group or another. Payment models don't fall into that, right? Because there are some organizations to which payment models don't apply. So that becomes a subgroup within something else, right? It doesn't need to be its own tent. It needs to be a little apartment inside the tent. I think, Helen, you've talked about some of these, and again, I'm just seeing some faces on here, but everybody has talked about this on this session. Like, there are some themes that bubble up to everybody, and if we can recognize that and advocate that message, then there is there's more cross-cutting than there is division. Yeah, why is it that NEMSMA brands itself as like the training ground for up-and-coming managers when every single organization needs to do that? Does that mean they all need to be a part of NEMSMA, or should NEMSMA be filtering its messaging into a larger message that everyone can take home to their own communities? And I think that's the way we do it. Anyway, I'm going to get off my soapbox. Hopefully I've given you all some things to as some overarching messages here. I'm so proud of everybody on this.
Yeah, there's some good stuff. And what I'm thinking, looking at all this, and a lot of this has been addressed, but we'll put this out to everybody. First of all, I put both in the note in the chat, and here are my emails. Send me your email so we can communicate. I'll create a Dropbox as well as a Google Drive for all the stuff that we have and we've done so far. So everybody.
And then we'll put that in the social media channels.
Yeah, and not only get into, but you know, if you're all players, we'll obviously let you edit it. We have to address threats, but we need to start thinking about strategies. And my thought on strategies, and this is not tied, it's up to the collective group, whoever the group becomes, is develop at the end 50 strategies. And I think we need teams and groups of people to say, okay, when we're the last week when we identify the strategies, we got to get groups of people that actually will put some meat into what these strategies are. And each strategy probably should have a paragraph. Some might have two, but the document's going to probably have a few pages. But I think that's what's really going to make this process that we spent over the last 4 weeks and another couple of weeks, it's going to make it beneficial as we move forward. And that's just my thoughts. Anybody else's comments, thoughts on that?
No, I think that's right. Look, one thing that I will tack on, I sent out some context today. So some of the folks that I work with who may not have understood why they were being invited to this or what it was. And I pointed out because I was afraid, again, I want us to use this hashtag unity, this theme of unity, and not to try to sound like a cheerleader, but it kind of is that, right? I mean, there's a lot of good stuff here and it deserves to be cheered. And what I realize is that there is a vision document that exists out there, whether one likes it or doesn't like it. EMS 2050 is an initiative that tried to do this, right? This idea of like casting into the forward into the future and seeing where we need to go. And I think it's worth distinguishing between an initiative like 2050 and almost looking at this as a 2021 or a 2022. These are near-term things, right? And again, I think for all of us who recognize that, for example, keeping people from killing themselves is an immediate priority, right? That's not something that can wait 30 years. There are solutions that need to be addressed in the meantime to get people thinking about how to be better to themselves. There are some payment model issues, right, that we're about to talk about in September, assuming ET3 goes forward. And Ryan and I have been talking about how even if you're not an ET3 selected quote unquote organization, how can you still learn from those lessons and adopt, take the messaging into other places, just like I've tried to do with places that can't do community paramedicine, but can do other things that kind of look like it, focused on opioids and, other types of substances, because the lessons don't have to be pigeonholed. And so, Tony, I think that's something that I hope as you work into the strategy, a theme of near-term solutions, right? Having a vision of where to go in a far-off vision. And I think of it like I have a wonderful view from parts of my house. And someone pointed out to me that there are 3 rows of hills, right? There's Mount Diablo way off in the far distance, and it's amazing to see it. But along the way, you have foothills, right? And those foothills have plenty to look at too. And it's kind of a neat little analogy. I'm gonna have to step outside later and think about that, right? But there are nearer term goals that we should be thinking about. And so tranching the successes and tranching the priorities as to what we can accomplish now, that's really about everyone sort of wrapping their arms around some urgent problems. And then what are the things that are sort of in the middle, right? Again, changing the lexicon from reimbursement to compensation. Is that gonna happen in the next 2 weeks? Probably not, but that could have some really interesting implications over 24 months, right? It doesn't have to be 30 years. And then having this sort of far off vision of 2050 and so on it's not redundant, right? It's a continuum. And I think, again, if you look at it that way, just like we're talking about having that continuum related conversation here, that first response and critical care and fire and private service are not unrelated to each other. They work together, right? Hurricane comes in, COVID comes in, everybody's picking up the gauntlet and trying to figure out how to work together. So having that unity, that continuum, that spectrum effect, I think leads to the political power of being able to say, here are the priorities that of all the different kinds of organizations here, there are 5 priorities or whatever it is that everybody agrees need to be addressed. And if we can have common messaging around that, you can put that on a piece of paper, submit that to a brief, and give it to Ryan Thorne, who's going to be president someday, and have him take that. There you go. See, you didn't even shy away from it. That's how you know. But the idea of people, again, Amy, other people who understand how to work these communication channels, who work with legislators, who work with influencers. And again, going back to the fact that everybody who's been on this call, there's been nobody on this call over the last 3 weeks that I've been with you, Tony, who has been someone who I would consider unimportant to that mission, right? No matter what your stripes are, no matter how many bugles or stripes you have on your lapel or stars or whatever, it's a community. And I think if we can drive that message home over and over again, that leads to the political power that leads to change. But you have to have some common threads that people can say, I don't care what color your patch is, I don't care what type of service or how you get paid, everybody cares about making sure that our people go home to their families safe, for example. And if we can continue to talk about that, then we can say, what are we going to need to do to make that happen? And we can put some tactical things underneath those strategy bullets. That can be, momentum begets momentum. And with that, I will arrest my own momentum and let someone else take over, or thank you guys. Well, and thank you guys all for being here.
Well, before we see if anybody else, and we wrap this up, because we've went, how long? 2 hours and 8 minutes. So this is the
a little longer each time.
Yeah, the longest. So, but my point is, yes, we will at the end, and not the end, but in a couple of weeks, we will take those strategies. I put in there prioritizing them, stuff that we can accomplish now, things that we see in the future. But my goal with this was, let's get through the first 6 months to a year. And as we're doing that, we can make this an ongoing process that, hey, we're working to those 6 months to a year strategies. We have the tactics. We're actually making stuff happen. And as they start falling into place, we could then move on to the others. As you said, there's a lot of brain power here that know how to do it. They do it in their own agencies on a regular basis. We're just taking it to a more global nature. We need their thought and brain power of actually how to do that. I mean, I have my thoughts, I'm sure, and I'm sure we'll all come to a consensus of how to do that so we can be effective. And as somebody said, some of these things, just discussing them should have had enough impetus, and you go, you know what, when I get off this call, I'm going to do X, Y, and Z for my organization and my people. And, I'm going to do this on Monday when I come in. So it doesn't have to wait till next Friday or wait till we have the strategies done. We're already going to move them, but we have to have a forum once we get done to put this out. Even if it's everybody just puts out on their own individual social media and in their organization, but we need to get this information out when we get done with it. But we have to have it packaged nicely that it makes sense, it's usable, and people want to utilize it.
Speaking of that, Tony, and I know you've been doing this anyway, but want to throw it out to the group. Send me the videos or a link to the video. Right, what I'm going to do, assuming that everybody's okay with this, which I kind of think we are, given that this has been an open forum, is I want to post them. Right, there were a number of people who had to leave, whether it's going on calls or other business. And I think, putting this out in social media, again, you've got the hashtags here that we can see on screen. I think at the very least, I'm not trying to create new things where people aren't. We know that they're on Facebook. We know they're on LinkedIn. We know, Instagram is something that I don't use it as much, but I've been, talking about adding to that. So I think if we put these things out there and let the world see it, one thing that I think is wonderful about this forum is our faces are present. As I say that, I will. Thanks, guys. Gotta live it, right? But I think the fact that people's names are here, no one's hiding, right? We're all sharing ideas, like you say. It's all been very respectful, and I think that is something where if we can let the world who hasn't been able to attend know that we've been doing this, that will pretty organically move the conversation forward. If anybody has an issue with us posting it, please let me know. But other than that, I want to put that out there into the world, Tony. So send that to me. I'll make sure we get them online. And that way everybody can tag them, they can link to them, they can forward them. And you got a couple hours of really good content here so far. And like you said, we've got more to go.
Well, what I'll do is I'll send you the video. If you do like you did last week and you copy the notes and send it, what used to be 18 pages is probably going to be 30. And in between, either you guys contact me or Jonathan or both, any thoughts you have in between. Threats, I'm just spitballing this and you all think about this. I think threats we can probably do in a half hour, 45 minutes, and move right on to start figuring out how we're going to, not what the actual strategies are, but how we're going to address developing these strategies to make them usable. And as said in here earlier, we need to be respectful. We're doing a great job at that, and communicating in a way that if we have differences is how we find common ground and come to consensus. Is anybody else, because Jonathan, we went from 38 and we're down to 17. Anybody else have anything to add?
Yeah, I'm going to look at it as we started with 10 and we ended at 38.
Right. Anybody else? If not, we'll end for today, and you know, we'll continue this next week, same time, same bat channel. Good.
Anthony,
Good.
I just wanted to say thank you to everyone that took the opportunity to speak and to engage everyone. So I'm just appreciative, and this is going to light a fire that I've been wanting to start. So thank you all.
Thank you. And I saw a lot of your comments, Eric, and they're spot on. And yeah, we all got to light fires. So if we all light a little brush fire in our own little corner, it's going to spread and the light's going to be able to be seen by the satellite. So agreed. With that, unless anybody else raise your hand or say anything, I'm going to close this out for today, and we'll move on. And again, I will share in both Dropbox and Google Drive, so you can access everything we've been working on. With that, Jonathan, let's close it out. We'll talk to everybody later. Have a great day. And let's stop the recording.